Hey, Braidy, how do I help? I met Dr. Braidy, I think it was 2018. The right knee was first, then the second one was the left knee. Then I did the right shoulder, and then I did the whole reverse on the left shoulder.
I always tell him he's my first patient that we've successfully done 4 joints on, repair or reconstruction.
When I first met her, right, she was a person that you could talk to. You could tell that she cares about you. She talks to you the way you need to be talked to, and she yells at you if you're doing things you're not supposed to, which I do sometimes.
Go crazy with the weights, start easy,
I am.
work
Like
your way
even
up.
this one is just a 5-pounder.
Keith is one of those guys that will keep going no matter what, so he's always difficult in the rehab because you have to pull him back a little bit. He just wants to go, and one of the hardest things to recover from is a knee replacement, and he sailed through both knees and went back to work full-time afterwards.
She had one person that was so scared, and she asked me if I'd go talk to him because I had the same knee procedure done, a replacement. He was worried he wouldn't be able to golf. I went in and explained to him I enjoy golf. I can play the rest of my life with my sons, but if I'm in pain, I'm not going to enjoy it. I can walk up to 36 holes playing golf. And he was surprised, and he says, you know, how is the pain? I said, the pain's going to be tough at first because the knee's a tough one. But once you get through it, you're going to be so grateful that you did it and not be in the pain you're in now where you can't play golf because you're in pain. You can't play anything when you're in pain.
When he retired, he started to have shoulder pain.
I stayed with pain for about a year. And then I finally came and said, I have to do something about this. And she says, yes, the total replacement is called a reverse shoulder replacement.
My goal is to get people back to doing what they love. And whether that is repairing something or replacing something, the goal is to get people to minimize the time that they're out and get them back to doing what they want to do.
She did that October 31st, Halloween. The first week, and my shoulder already started feeling great. 4 weeks after that, and I could do mostly every exercise she gave me, almost 100%, and you're only supposed to get 40% by then.
Oh, that looks good.
Yeah. Today, which is 10 weeks, I can fully do everything. I had grandkids coming, so I had to do a lot for them, and I wanted to be there for them, and I am there for them. I babysit 3 days a week for my newest one. I love it. We go to the park every day. I have to get the carriage ready. I pick him up, bring all his stuff too, and then we walk from his house to the park, and we have lunch there. We go down the slides, and the big slide, I even go down with him because he loves that. I don't think I would have been able to babysit him without the chance of me getting hurt, and then I would have to worry because I'm by myself with him all the time.
I never get tired of hearing what patients are happy after their end result, no matter what that is. I'm just happy that he's doing what he wants to do, and even just daily activities and getting back to golf I know was a big thing. Weightlifting for him, although modified after shoulder replacement, but for him to be able to just do what he needs to do on a daily basis, and he's an active guy, so it was really limiting him.
You're gonna reach the knees.
In pain, you really can't enjoy yourself, playing sports, working, doing anything you do. So I feel if you stay like that, you're losing your ability to be a person. You fix yourself, you get strong again, and you're going to be a happy person. You're going to be in a good place. It's not part of getting old. If you can be better, why wouldn't you want to be? If you can feel hardly any pain, why wouldn't you want to? And maybe you might feel no pain. It'd be crazy not to enjoy what you're doing because you're not really enjoying it if you're in pain.
All right, we'll see you in 6 weeks.